Welcome back. Experts say when it comes to mental health services, there's a big gap that needs to be filled sooner than later here in Central Texas.
Our Olivia Leveda stopped by Advent Health to get some insight on what doctors are calling a major crisis.
That's right. I had the chance to meet up with some local doctors who shared once their patients leave, it can take months to find continuous care. On an average day, the team at Advent Health Behavioral Health Services sees 10 patients in the emergency department. In addition, they receive a minimum of 70 referrals to bring patients into their outpatient care.
From either an emergency department setting and or an inpatient setting, they require services in order to continue medication. That is a key component.
However, once they leave, receiving those services isn't always so easy.
Because what you will see in this area is there are wait times that can be months on end.
We call around to at least a dozen mental health providers in the Central Texas area. The shortest wait time to see a psychiatrist, about 2 weeks, and the longest, up to a year.
They need to have therapeutic intervention once they leave here. What happens is without those services, they end up coming back to the emergency departments, coming back to the behavioral health facility.
We spoke to a woman in Bell County who battles major depressive disorder, and although she was unavailable to meet in person, she had this to say over the phone.
That doesn't surprise me, the big difference it takes for people to get in to the doctor. In my case, I had a regular psychiatrist, but my insurance changed and I didn't know it. So I had a change in PCP. It took me 3 months to get in to see him and an additional 6 weeks to get in to see the psychiatrist.
She says she's seen firsthand the impact lack of care can have.
When you have somebody in a situation with major depressive disorder and somebody that could be suicidal, I have a friend of mine, for example, it took 3 months. The doctors just kept pushing out her appointment, pushing it. And for 3 months, she went without medication. And the end result is that she took her own life.
You see that gap of people who do commit suicide because of the lack of services in the community. We discharge somebody from here and we are looking at a month to 6 weeks to 3 month appointment to get them in to see somebody in an outpatient services. They decompensate during that point in time. This is the type of situation that can happen.
Even with the gap in resources, he says there's still hope.
We're bringing on clinical social workers to do therapy. We're bringing on nurse practitioners to assist with the medication management and the therapies. We're bringing on psychiatrists.
And they say if you haven't found help yet, they recommend you do 2 things. 1, talk about it, and 2, seek help. In Killeen, Olivia Leveda, Central Texas News Now.
Thanks, Olivia. Now, according to the National Alliance on Mental Illness, adults in the U.S. living with serious mental illness die on average 25 years earlier than others, largely due to treatable medical conditions.